and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're dedicating this show to Sam. So good evening, Sam. I hope you're fine and listening intently to all this news. Good evening. You're on the radio. This is Dr. Lederman.
Yes, I have a friend of mine who has cancer in several places, and I want to push him to go see you, but I need some idea of what this thing costs. I used to work with this gentleman, and he's a good friend of mine, and he's just sitting back, not doing anything.
Mm-hmm.
He has a non-small cell, and it's in his sternum, his right hip, and also in his lung, one lung.
Well, this is exactly the kind of work we do. We treat cancers in the bone, and the sternum, and the hip, and the lung. Again, we were the first in America to do this work. First of all, it's all covered by insurance. So if he has most insurances, Medicare, Medicaid, that's...
I know what he got because I used to work with him. He has Sigma.
Mm-hmm.
He has Medicare and Sigma.
Well, that's fine. Just have him come in. We'll take care of him immediately.
But could you give me any idea of what it might run? Because this guy is everything's the valve.
Well, number one, it's covered by insurance. So, Medicare tells us, well, we'll talk about that when you come in, but Medicare tells us,
Get him to come in unless I tell him something.
well, tell him most likely it's all going to be covered because he has Medicare and Cigna, so it's all going to be covered. I don't think he's going to spend 2 cents. Maybe he won't spend 1 cent. Is that a good answer for you?
Because I got to push him because he's just sitting back doing nothing, and
Well, you don't have to push him. People should be...
he's sitting back not doing anything.
Right. Well, you don't have to push them. People should be motivated to have treatment that's highly successful, non-invasive, quick, convenient. So everything about radiosurgery is appealing for this man.
The bone itself. So
I understand that.
do that?
Yes, we do. We do it every day.
Okay, so there shouldn't be a problem then. I mean, is it curable?
It's controllable. Where we aim the beam, we can stop the cancer. Where we attack it, about 90% of the time. So it's a very successful treatment. And most likely will take that cancer away, make the bone heal, and put him in remission. But I have to see his case and know more about his case. And
I know that, but I'm the one who has to convince him because he's not doing anything. So that's why I wanted to know a little bit about it. That's why I know he has the same insurance as I do because we used to work together.
Okay. Well, then there's no reason why not. But as Abraham Lincoln said, you can lead a horse to water. So we make the...
He got a head as thick as a nail.
Well, I don't know about that, but I'm just telling you it's very appealing and successful. I'd be happy to sit down and tell him everything I've told you and more, and review his records, his documents, and show him why or why not he may not want treatment or may want treatment. So.
Well, if he doesn't get treatment, he's bound. He's in a lot of pain and everything. He tells me, and
well, most likely we could.
He's in terrible pain, and he's just sitting back doing nothing.
Most likely we could get him out of the pain very quickly. Radiosurgery works great for bone metastasis like in the sternum or the hip. Usually the pain is relieved very, very quickly because we focus the beam on the cancer. We can give a high dose to kill the cancer and not hurt the adjacent tissues. So it's a very nice treatment for him.
He has a non-small cell, so is that better?
Well, it's what he has. I'm telling you the results for non-small cell. I'm telling you exactly the results for non-small cell, because it doesn't help for me to tell you about kidney cancer when he has non-small cell lung cancer. So that's exactly what I'm talking about.
He has non-small cell. That's better than if he had small cell, right?
Well, that's what he has, and our success rate is very high to hit the cancer where we aim the beam and stop, shrink, or make that cancer go away for the rest of his life, most likely.
Okay, I'm going to call him back. I got to work on him.
Okay. All right. God bless you, and thank you.
You know what I mean?
No, I don't know what that means, but I am sure that he'll do the best thing for him.
Okay. Well,
Okay.
thank you very much. I
Okay.
appreciate it.
God bless you, and bye-bye now.
God bless you. Bye.
So we believe, obviously, that we should inform patients as to all the risks, benefits, and alternatives. If someone wants to come, it's fantastic. I don't think you can make people do things against their will. I don't think that is a good strategy. But the treatment is very appealing. Sometimes people are afraid of chemo or surgery or standard radiation. This is none of those. We go to hit the cancer, not to hurt the healthy tissues, and in this man who's suffering in pain, to try to relieve his pain and get him back functioning like he was before. And on the opposite ends of the spectrum, we have a patient who came in this week with about a half-inch cancer right in the middle of his cheek on the right side. He has a lot of sun exposure. He had a cancer there 2 years ago. It was scraped off, but they didn't get the roots of it. He didn't even see the doctor. He saw some assistant who scraped it, and it was a squamous cancer, never treated, and now it's growing back. And he's obviously afraid to have surgery. And there was an article today in New York Times about Mohs surgery, about how it's done layer by layer and how expensive it is, and can be very deforming because it cuts through lots of tissue often following the cancer down. So our treatment is non-invasive to treat skin cancers, and there's lots of cancers around the eyes, nose, mouth, and ears, cheeks, where surgery would be most likely deforming and where we keep the normal tissues intact. So we told them our data, which is very appealing. It's all outpatient treatment. We treat skin cancers. We've been treating them for decades and have had quite a successful impact on them. And speaking of impacts, one of the biggest impacts in our society has been colonoscopy. And colonoscopy has been reducing the incidence of colon cancer. In the last decade alone, there's 30% less colon cancer than there was just 10 years ago, and the death rates keep falling. So since the mid-1980s, the incidence of colon cancer is plunging, 30% down in the last decade in Americans 50 and older. More people are getting colonoscopy. The fall in death rate in colon cancer is falling 3% per year between 2001 and 2010. This is according to a report produced by the American Cancer Society. The chief of the American Cancer Society estimated that without screening, we'd be seeing twice as many deaths as we're seeing. African Americans have a 25% higher risk of colon cancer than whites and a 50% higher risk than Asian Americans. It's attributed to socioeconomic factors and genetics. Please, all Americans, especially over the age of 50, have your colonoscopy. I have several friends, unfortunately, with colon cancer. They never had their colonoscopy, and by the time they got it, it was too late. So experts suggest starting at age 50 to undergo either colonoscopy every 10 years, a test for blood in the stool once a year, or sigmoidoscopy, which is a more limited test. Colonoscopy is the most popular. It's increasing so that the majority of people are having colonoscopy. So please consider colonoscopy. We've talked about that. We've talked about cutting down on smoking tonight, which will help reduce cancer rates and make you live longer. So that's what this show is about, to try to live longer, be more healthy, have more successful treatment. Again, my name is Dr. Gil Lederman from Radiosurgery New York. We're happy to mail a booklet and DVD to you. We have several booklets, one on brain cancers, one on body cancers, and one specifically on prostate cancer. Our office phone number is 212-CHOICES. 212 Choices, and we chose that name because we had choices of which phone number, and we wanted you to have choices and to remember that you do have choices. Just like the callers you've heard tonight and the cases you've heard tonight, people do have choices. So you're welcome to call us at 212-246-4237. We're super convenient, but we're not only super convenient. We try to take care of patients. You have the doctor, not a student. We will see you within one business day. So give yourself the most chances by give yourself choices. Come in. Thank you for listening. God bless you, and good night.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. You've been listening to a podcast from News Talk Radio 710 WOR, 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 WOR.